Hello, good afternoon. It's Chief Roger Martin here, along with Councillor Gina Russell. We'd just like to give you guys an update of what we've been doing so far and with the COVID-19. We're to get started. We'll just, Gina, if you have any open comments.
Good afternoon, everybody. I know it's a trying time. It's unprecedented times that we're living through. It's a very fluid situation which changes just about by the hour. What I can say is that we're very fortunate here at Cold Lake First Nations. We have our emergency management team who are working daily and briefing all chief and council as to the ongoings of what's going on. Do you want to do that, or do you want?
Don't matter.
Okay.
Chief and Council, our roles and responsibilities for Chief and Council during this disasters are to maintain communication with emergency staff managers, directors of emergency management during the terms of this emergency as follows. Occupy the Chief and Council's office located at the primary or alternate at the Emergency
Operations Center.
Operations Center, yes. I just don't know the acronyms right now. Draft of execution, BCR, declaring emergency upon the recommendations of the directors of the emergency management team.
I'll just go in there.
Yes.
So last Tuesday, we had a Chief and Council meeting, and so that was there then that we decided that we would
declare a state of emergency.
Yes, declare a state of emergency. And that was also the time in the morning that we decided that we were going to close the casino. A lot of meetings and dialogue up to that point were ongoing, and I feel so far we're kind of ahead of the game, and I'm very happy with where we are at right now, considering that it is a global pandemic.
And I know a lot of the main concerns that people ask about, like the food vouchers and stuff like that, that was one of the main issues that we keep getting bombarded with calls and stuff like that. And we are currently working with our emergency EOC, emergency office, and we're currently with our staff. We're currently on protocol and getting things lined up because we don't know how long this COVID might be. Like, it's only in this infinite stage right now. We don't know if it's going to be a week, a month, a year, we don't know. So we're taking all precautionary measurements with our team to ensure our band members and the safety of the community around, that we're doing our diligence the best interest is for you people, our band members. And
right now we are getting calls from off reserve nation members. We understand that your needs are just as important as the needs here on the nation. Presently, family community support services and the food banks are available to you in Edmonton, Calgary, or the nearest city or town that you live in, and we are moving forward to that. We haven't set things in place as of today.
Also, our emergency operations team team asked also that if any of your family have to self-isolate, they could just, for any precautions, whatever they need to do, they could just call the center at 594-7184 or call 594-7185. Just for any information that you guys might need. Our staff is here for you guys, so feel free to call. And yeah.
Those numbers are really important because that's how we're going to track you. If one of your family members gets sick or showing any symptoms, they will have to call these numbers, and that way the emergency management team will be able to track you and monitor you and follow up with you on a daily basis. This is our only means of communication at this time, as all band buildings are closed, and it's only the emergency management team that are being allowed into the buildings. The health center, they have staff there as well, but the nurses are on rotation. If things turn south and someone gets sick, we have to make sure that our health team are there to provide what we need. The food voucher program is now finished. The call center is now focused on giving you the most up-to-date information in regards to this pandemic. We can direct you to resources both to the federal and provincial funding, provide you with up-to-date information on COVID-19, give you the phone numbers for mental health services. Charles, our band administrator, is right now working to make it available to assist you on how to claim for EI for those affected who've been laid off during this pandemic. The emergency operations team is working hard to pre-planning for the worst, hoping for the best, and will keep you informed of changes as this situation evolves. They also
and I'd just like to add, if try to self-isolate, stay at home, take the precautions. That's the only way we're going to stop it, is if we just all work together and try to do our best to just self-isolate. And then if you need some PPE, there is some available, but there is a shortage right across Alberta, right across Canada. So if you come to,
If you need PPE, again, that would be if there is somebody who has COVID in your home, and so those materials will be made available to you. And we just want to state too as well that the DAM, our Deputy Emergency Manager, and our Emergency Operations Center will not be coming on live. I know some of people have requested or asked why they weren't here, and it's imperative that the leadership be the ones who do the communication. And I know Kelsey and Dion in the past have done a great job, but we have to isolate ourselves, and the least amount of traffic coming into the band hall at this time is really important.
And I'd just like to add, there will be a drop-off box for all your utility bills and stuff like that.
For the elders.
For the elders and people on social assistance, there is a drop-off box over here, so that would be here. So.
And if you have any questions or you can't get through the telephone lines and you need to let us know what's happening with you, feel free to put in your request or tell us what you require. And to go back to this COVID-19, it's very contagious. There's no treatment for it. If you get it, and if you're elderly, if you're 60 plus and your immune system isn't very good, could be very detrimental. And with conversations with our health staff, if you have COVID and the ambulance drivers come to your home and they take your loved one out, that may be the last time you'll be able to see them, because once they're in the hospital, there's no way for you to go visit them or spend time with them. The numbers increase every hour. There are people dying in Canada. You could see on the news the numbers. They're announcing it rapidly. Twice a day they're telling us the numbers.
So on that note, there you got to be cognizant of the amount of ICU beds that are available. Edmonton has maybe, I'm not sure, I know in Alberta there's not enough. So if you get really sick, the ICU bed, chance of getting an ICU bed are very slim. So that's why we can't stress enough to self-isolate and take the necessary precautions to remain safe.
And when they say flatten the curve, it means flatten the spread of COVID. If you stay home, wash your hands, clean your surroundings, don't go run next door, don't go run to your grandparents or to go visit on the elderly, phone them, talk to them FaceTime. Some of them can. It's just really important that we do everything, and it's our responsibility, each individual's responsibility, to stay home and not spread the virus. We got to let this virus get rid of it, bottom line. And if anything changes, be sure that Chief Roger and Council, we're always being informed and brought up to date, and we will bring that information to you. Masicho.
And I'd just like to give a shout out to our team that's been working since this whole crisis started. They're doing an awesome job. And like Gina said earlier in the conversation, compared to some nations and in Alberta in general, we're on top of a lot of things. So just to let people know that we are definitely here for them, and we're doing all we can. Thank you very much, Masicho.
Have a good day.
Have a good day. Bye.